Not all data is created equal. Why the BIS surgical procedure volume database dominates the industry. The big reality. In healthcare, decisions worth millions, sometimes billions, are made based on data. But here's the uncomfortable truth. Not all surgical data is created equal. And when your forecasts, product launches, investments, or expansion strategies rely on inaccurate procedure volumes, the cost of being wrong can be massive. The industry problem. Most surgical procedure datasets in the market rely heavily on broad estimations, outdated public sources, or black box modeling assumptions. They give you numbers, but they don't always give you transparency. They don't always give you segmentation depth, and they rarely give you confidence. In fast-moving markets like surgical robotics, minimally invasive technologies, or specialty devices, surface-level data simply isn't enough. What makes the BIS surgical procedure volume database different? This is where the BIS surgical procedure volume database stands apart. Instead of relying on single-source estimations, BIS Research builds its database using a multi-layered validation approach, integrating national health registries, hospital utilization data, peer-reviewed clinical publications, insurance datasets, and expert inputs from practicing surgeons. That means you're not looking at inflated projections, you're looking at grounded, validated intelligence. The platform covers more than 40 surgical specialties, with segmentation across open procedures, laparoscopic procedures, robotic-assisted procedures. And in markets like the US, it goes even deeper. Layering and demographic overlays, cancer incidence data, hospital capacity metrics, and multi-year forecasting models. This level of granularity allows decision makers to answer not just how many procedures, but where they are happening, how they are evolving, and what that means for market opportunity. The strategic angle. Why this actually matters, here's the bigger picture. In today's healthcare ecosystem, precision is competitive advantage. If you're a MedTech company planning market entry, an investor evaluating surgical technology adoption, or a hospital network assessing capacity planning, you don't just need data, you need decision-grade intelligence. And that's the difference. This isn't static data sitting on a spreadsheet. It's a continuously updated, living tracker of surgical trends, technology penetration, and procedural shifts. Who benefits MedTech manufacturers, consulting firms, healthcare investors, hospital strategists? The organizations shaping the future of surgery depend on accurate procedure intelligence, because even a small miscalculation can reshape an entire growth strategy. If you want to stay ahead of surgical innovation, market shifts, and healthcare intelligence that actually drives decisions, follow BIS Research for more deep insights into surgical markets and emerging healthcare technologies. Don't just work with data. Work with data that works for you.